here. We first start by drawing a blood sample. We want to make sure that the pet is healthy enough to be going under anesthesia to have its teeth cleaned. So we're showing you that we're drawing the blood sample. We're placing the blood in a tube where we would spin it down and run it in our blood machines, or we may send it out to the lab and have results the next day. Here we're showing you how we give the pet a pre-anesthetic injection. It's an injection that will help make the pet calmer, more relaxed, so it's not so nervous as we get it prepared to place an IV catheter. This is Storm, by the way, and Storm's being real good. Now we're clipping Storm's arm or paw to place a catheter. We clip the fur away so that we have a clear view of the vein, also so that we can make sure the skin is nice and clean for that catheter placement. Now we're placing an IV catheter. The purpose of the catheter is to start the pet on IV fluids. The IV fluids help increase the blood pressure during the dental cleaning procedure, making the procedure a little bit safer. It also clears the anesthesias out of the system a little bit faster, and it is an extra precaution to make the procedure as safe as possible. Here we're starting IV fluids in the patient prior to anesthesia. So here's the fluids dripping down into the patient through that IV catheter. Here we're giving the patient the induction agent. That's the anesthesia that will make the patient very sleepy and relaxed so that we are able to perform the procedure without them waking up. Here we're pulling the dog's tongue out so that we can place an endotracheal tube. That's the tube. It's going into the trachea. This is to help maintain oxygen and anesthesia to the pet while we're cleaning the teeth. It's really important to maintain adequate anesthesia during the procedure to keep the patient still. That way the technician or the veterinarian is able to clean all surfaces of the teeth. Right there to the left of your screen is the anesthesia machine. That's where the anesthesia comes through the tube and goes into the patient's endotracheal tube. The little gray cord that you're seeing is a respiration monitor. The clip on the tongue is a heart rate monitor and an oxygen or SpO2 monitor for the patient. All these monitors let us know if the patient's maintaining an adequate plane of anesthesia, that the heart rate is normal, that the breathing rate is normal, and that the amount of oxygen in the bloodstream is normal, just to make sure that everything's going well while we're cleaning the teeth. Here we're demonstrating to you a dental probing. We're trying to see if the gums are nice and adhered onto the tooth. If that probe can enter underneath the gum line more than 2 millimeters, it's more than likely that the pet has a tooth root abscess or an abscess underneath the gum line. That means that infection has spread underneath the gum line. Notice that tooth right there? We're trying to point that out to you. Notice how inflamed the gums are? There's probably a pocket of infection right there. It's very inflamed. The probe, however, doesn't go under 2 millimeters though, so we'll probably be putting this pet on some antibiotics. Here we're beginning the dental scaling. Notice the brown beige calculi being scaled off of the teeth there. We're trying to get every bit of that off the tooth. We're trying to go slightly underneath the gum line, holding that tip at an angle like that. Notice the water spray from our scaler. This water is to rinse the calculi that's been cleaned off of the tooth away. It also keeps our instruments nice and cool. we're spending extra time cleaning this area of inflammation. We want to make sure any bit of infection that is spread under the gum line is cleaned up. Now I've condensed this video down quite a bit, but as you can already see, the teeth are looking a lot better. In this portion of the video, we're trying to demonstrate to you how we are cleaning the inside surfaces of the teeth. We want to make sure we clean the entire tooth, outer surface and inner surface. We don't want to leave tartar on surfaces that are not seen by the pet owner. For this next segment, I'm going to turn the volume back on in our video so that you can hear how loud the dental scaler is, so you can have an idea of how nervous or how scared our patients may be if they were actually awake for this procedure. Now we're using a combination of distilled water and air to clean and rinse the mouth. At this moment, we take the opportunity to check under the tongue, around the gums, deep in the throat for tumors and other lesions in the mouth. Now this is prophy paste and a polisher. The polisher applies the prophy paste onto the surfaces of the teeth. The head of the polisher spins, allowing an even spread of the polish onto the teeth. It prevents grooves and nicks on the surface of the teeth, making it a nice, clean, smooth surface so that additional tartar and calculi are less likely to adhere to the surfaces that are freshly cleaned. Now, it's real important to have your pet's teeth cleaned regularly. Having infection in the mouth actually promotes infection elsewhere in the body. When there's bacteria in the mouth, when the pet swallows it, it actually showers the rest of the body with bacteria, causing bladder infections, kidney infections, and even heart infections called endocarditis. Now, after polishing all surfaces of the teeth, we then spray on a fluoride foam. The fluoride is allowed to soak into the surfaces of the teeth. Then we apply a sealant. We first dry the mouth and the teeth, and then we apply a thin film of the sealant onto the surfaces of the teeth. We spread it with our fingers. Again, the sealant helps to add an extra barrier on the teeth. It creates a smoother surface on the teeth, preventing nicks and grooves on the teeth that will adhere to tartar. Now the procedure's done. Storm is taken off anesthesia, and we're starting to wake up. The patient is awake and able to lift its head. We allow them to recover on warm blankets and a cot. The IV catheter is then removed, and a bandage that looks like a Band-Aid is placed onto that leg. Now this bandage that we are applying is to keep pressure on the catheter site to prevent a little bit of bleeding. If this bandage is on when your pet is released from the hospital, you can just gently remove it by unwrapping it at home. And here our patient Storm is awake, able to look around, not quite able to stand yet, feeling good. We will probably be leaving to go home in about 3 to 5 hours, feeling great with a clean set of teeth and fresh smelling breath.